The Ministry of Health is on the trail of 75,000 Kenyans who have come into contact with those who have contracted the coronavirus. The ministry made the revelations as another 671 cases were confirmed from 6,200 samples tested in the last 24 hours, taking the country's caseload to 23,873. Health Cabinet Secretary Mutahi Kagwe, who was on a tour of the Kenyatta University Teaching and Referral Hospital, said the recovery rate of Kenyans is giving hope and the home-based care is proving to be a cheaper option in containing the virus.
COVID-19 patients in the country will be free to continue with their normal life after 10 days of isolation if they do not exhibit any COVID-19 disease-like symptoms. The Ministry of Health says the decision was arrived at after research from wards scientists revealed that within this period, the patients will have a shed of the virus and it will no longer be active for further spread.
We are using the new WHO CDC guidelines. We don't need to retest you if 10 days after your symptomatology, you don't have any fever and you're not using any fever-reducing medicines for the next 3 days. So after that, 10 days plus 3 days, without any symptoms, no fever, you don't need a retest. Because studies have shown that even if you retest you after 20, 30 days, you could still be positive. But you are shedding a virus that is not infectious. So wasting a very scarce resource that has posed a challenge to our country.
To date, the ministry is trailing 75,000 Kenyans who may have come into contact with those already infected with the deadly virus. Speaking during a tour of Kenyatta University Teaching and Referral Hospital, Health Cabinet Secretary Mutahi Kagwe announced that Kenya had recorded an additional 671 cases of coronavirus in the last 24 hours from 6,200 samples.
633 of those people are Kenyans, while 38 are foreigners. 413 are male, while 258 are female. The youngest is a 3-year-old baby, while the oldest is 94 years old. Ukisikia ati iko familia moja ya watu 48 ambao familia moja iko COVID positive, hiyo ni kusema ya kwamba hii virusi imeenea kila pahali.
Nairobi registered 376 cases, accounting for the lion's share, followed by Kiambu with 112, Machakos 20 cases, Kisumu 16, Kajiado 16, Busia, Uasin Gishu 15 cases each, Nyeri 13 cases, Bomet, Kericho 9 cases each, Meru 7, Mombasa 6, Embu, Nandi, Kisii 5 cases each, Garissa and Tana River 3 cases each, Kilifi, Murang'a, Tharaka Nithi, Trans Nzoia, Vihiga, Baringo 2 cases each, while Kakamega, Nyamira, Samburu and Taita Taveta 1 case each. 603 additional patients have been discharged after recovering from COVID-19, raising recoveries reported since April 1st to 9,930. The new recoveries included some 436 patients who were undergoing home-based care. During the same period, the country lost 3 patients, including 2 healthcare workers, bringing the number of fatalities recorded in the country so far to 391.
As of today, we have 723 healthcare workers, 385 of them who are males and 338 females who have been infected by COVID-19 disease. That is about 3% of the total caseload. The global average is about 10%, so we are still doing relatively well, but we are not going to rest on our laurels because our caseload is 3%.
We have said it for a long time. We have told people that they will take the disease to their parents. We want them not to do it. Some have already. So the only thing we can do now is to urge those who have not, please don't do so.
It is 146th day since the country recorded her first case of coronavirus in March this year. With infection being at the community spread level, Kenyans are being urged not to relent in following the COVID-19 prevention protocols. Purity Museo, Channel 1 News at the KU Teaching and Referral Facility in Nairobi.